So the first kind of glaucoma we'll be looking at is the primary open angle glaucoma. That's the POAG. It is the most common type of glaucoma. That is, if we want to look at people who have glaucoma, majority of them, about 80%, are going to fall under the category of primary open angle glaucoma. Now, we know that the eye has a drainage system that drains excessive fluid from the eye. That's the vitreous and the aqueous humor. And so when this drainage system, this drainage portal starts getting clogged, it will result to an increase in the pressure. We understand the logic, right? Because the water cannot be drained out because the opening or the system, the drainage system is getting clogged. There will be an increase in pressure. So that is the primary open angle glaucoma. It is the most common and it usually comes with no pain, you don't have any early symptom. So majority of people who have it usually stay with it comfortably until they start discovering that they have started having peripheral vision loss. Peripheral vision loss is when you are not able to see again by the side as you used to before. Maybe all of a sudden you're going to realize that if you're looking forward, you're not able to really see things by the side. So when you start realizing now that you have peripheral vision loss, you want to come to the hospital, you want to check, realize that you have an open angle glaucoma. And of course, early detection is better because we can always treat and prevent loss. Now, the second kind of glaucoma is closed angle glaucoma. Closed angle glaucoma, like the name says, the drainage becomes closed, and this one is usually termed a medical emergency. It is not very common, but it happens, and it is one of the most dangerous kinds of glaucoma. It happens all of a sudden, and it comes with pain. Now, this happens because your iris blocks the drainage system. All of a sudden, your iris just blocks the drainage system, and the pressure inside your eyes just increases, and it's going to cause you a lot of pain and a lot of headache. And when you come to the hospital, we see it as an emergency. It has to be acted upon as soon as possible. Like I mentioned, this is not very common, but this is one of the most dangerous forms of glaucoma. So if you have ever noticed that your eyes all of a sudden just started paining you, please do not rush to the hospital to have it checked. Now, how are you even going to know if you're probably having a closed angle glaucoma? Now, if you have severe headache, like if all of a sudden your eyes just starts paining and then it gives you severe headache and you feel nauseated and you also have blurry vision and you're seeing halos around light. You know what halos around light is? If you don't know, please leave a comment and we're going to explain that. If you see halos around light, then you should know that you should not joke with it. If you hear someone complain of such symptoms, you should know you shouldn't joke with it. You just tell the person to rush to the hospital. It's a medical emergency because it can lead to blindness if not handled immediately. The next kind of glaucoma is a normal tension glaucoma. So from the word tension, we already know that tension means pressure, but if we're saying normal tension, it means normal pressure glaucoma, right? So normal tension glaucoma. That's why I said from the beginning of this video that at first I used to think glaucoma is only an increase in intraocular pressure leading to optic nerve damage, until I got to realize